Hello and welcome back to our online patient meetings. Today it's Monday, so we are back at 6 p.m. UK time. And I hope you had a wonderful weekend and are ready to find out some more on our today's topic. And well, I would like to welcome back Laura Bicker, who has been with us already. She already had one of the online patient meeting, and I'm glad that you've decided to come back to us and simply discuss one more topic. Hi, Laura. How are you feeling? Let me know if you can hear me well.
Hi, Caroline. I'm good. How are you doing?
All good. Happy that you've joined our initiative once more. And of course, please let us know that you can hear us. I'm your host, Caroline, as always. And let me just simply mention that all the Stronger Together events have been brought to you thanks to our ambassadors and partners. And of course, you can see all of our ambassadors and partners right here on the screen. So as always, I want to mention them and simply thank them for their support. Okay, and thank you so much for confirming that you can hear us both. And well, today, as I mentioned, we do have another topic, and Laura Bicker, who is acupuncturist and Chinese medicine practitioner, she will discuss a topic on acupuncture and IVF preparation for conditions that may impact the outcome of an IVF cycle. So, Laura will start with her introduction, and then, of course, we will answer most common questions on our topic. But after this, remember, it will be time for your questions. So, all you need to do is just type it in the chat section so that Laura can help you out. So, don't miss this chance to ask anything that you have in mind so that Laura can help you out a bit. And well, I guess that is it. Laura, ready to begin?
Yeah,
Excellent. Thank you so much then. Go ahead.
thank you. So, I'm Laura Bicker, and I am a Chinese medicine practitioner. So, I offer acupuncture and herbal medicine to patients across the northeast of England, and I've been doing that for about 15 years now. And one of the things I found when I first started was that patients were coming to me wanting to conceive, and very quickly we found that it worked very well. And from there, it snowballed. So I then went on and specialised. And so for the majority of that last 15 years, I've been working with couples, helping them through their fertility journeys. And so I think these events are fantastic for anyone who's interested in acupuncture and wants to learn more. So just feel free at the end to ask as many questions as you want, and I'll do my best to help answer them for you. And when I did one last time, a lot of people were interested in where they can find an acupuncturist. And again, if you get in contact, we have a really wide network of acupuncturists, particularly in the UK, and we even have worldwide networks. So if there isn't anybody that I know of through my network, we can find you somebody who is qualified to help if that's something you're interested in. And I personally am part of a network called the Fertility Support Network, and the practitioners within there are all qualified, have been trained for at least 5 years. They use integrated medicine, so I can put you in touch with people who can help if you're interested as well.
And perfect. Thank you so much for that introduction. Of course, now I guess it is time for our most common questions. And as always, remember that you can type your questions right now or later on so that Laura can help you out as well. And the first question is, how can I help prepare my body for IVF?
So I think a lot of people during lockdown are feeling very frustrated. Things are obviously starting to get moving now, and clinics are starting to open again. But for some people, there's still quite a waiting list now because they've just started up. So I think a lot of people really want to know what they can do at the moment to help things. So I thought I'd go through some of the things that you can do for yourself while you're waiting. And almost like a bit of a checklist, because sometimes when patients come in for treatment, they'll say, oh, I wish I'd come to see you sooner, because there's a lot of information that we go through and, you know, advice that we give, and patients would have liked to have done those things earlier. So some really simple things that you can do to help yourself when you're preparing for IVF. And it might be that, you know, this is common sense stuff, but sometimes as well, you just need a little bit of a kick to remind you that these are important things to think about. So first of all, just very basically, eating as well as you can, you know, go for natural foods where possible, stay away from processed foods, go for the best quality that you can get hold of. So if you can afford organic food, then ideally buy organic. If you are working to the minimum, you can look at things like the Dirty Dozen that will tell you the worst foods that you can eat that aren't organic and which ones are best for you to buy. So those are little simple tweaks you can make without having to go completely organic. So looking at the quality of the produce you can get hold of, looking at the quality of milk if you use dairy products. Then if you have got, you know, digestive issues, or you have complex conditions, maybe looking and considering if working with a nutritionist would benefit you if you need to go on that deeper level. And then on that side of things, looking at what supplements you're taking. Often we see patients coming in who are taking too many supplements. They're doubling up. They're taking a preconception multivitamin, but then they've also read that maybe they should add this product in, and then they don't always realize that they're doubling up. So that again is where a nutritionist could really come in, because oversupplementation is just as negative as not having any supplements. So do your research on that side of things. Giving up smoking is a really obvious one. Again, you know, if you're struggling and you do smoke, seek help. There are different methods out there that you can use. You know, there's a fantastic book that a lot of people have found very useful, and you just read that. But there's lots of things out there. But we know that smoking actually decreases your reproductive years, and it can affect all the processes throughout reproduction development during your cycles. So trying to get rid of smoking where possible will really help. Alcohol, the research is mixed around alcohol. So for men, as long as they're having low to moderate amounts of alcohol, this should be okay. It depends again in certain circumstances. So if you were seeing somebody like myself, they would look at your constitution and be able to tell you whether you can get away with having alcohol, or if actually it is those tiny amounts that you might be having still having an impact. So what I would say is keep it low, because you don't want to feel necessarily like you can't have any fun and your life is on hold, but just be conscious that you're not overdoing it with alcohol. Definitely when you come to start an IVF cycle, we would say cut the alcohol out just for the cycle at least. But again, with IVF, there has been research that has shown reduced live birth rates when people have drunk excessive amounts. So just being conscious of the amount you drink. Caffeine, again, it's a little bit mixed. Sometimes we hear very negative things around caffeine and male fertility. Other times we're not seeing that it's kind of substantiated. From a TCM point of view, caffeine is a diuretic, and it's going to decrease the fluids in your body. Excuse me. And in certain cases, we'll see that perhaps there are issues in the semen being too thick, the women are having night sweats, and we want to be conscious that the body has enough fluids, so caffeine is going to have a negative impact on the body. Also, if you're a particularly anxious person, you struggle to sleep, caffeine isn't going to be great. So reducing caffeine as much as possible, switching to decaf will really help you. Another thing to look at is medication. So depending on if you've already seen a consultant or not, you may be waiting. Things that you want to check is if you're on any medication at the moment, does it have any impact on fertility? Because sometimes your GP might not have picked up on that, or you might not have got to the stage to speak to your GP. So doing that research to make sure you're not taking anything that is going to impede your chances of conception, because often there are alternatives that can be used. Exercise. You can't go wrong with exercise. It gets your energy moving, it gets your blood circulation going, it helps with your mental health. But on the other side, make sure you're not overdoing it as well. So listen to your body. If you're feeling tired, if you need a rest, then do rest. Make sure you get plenty sleep. And I would say, particularly in lockdown, people have really struggled with keeping good sleeping habits. So if you have got out of routine, try and work to get back into a good routine. And ideally, being in bed by about 10:30 is where we would want you to be as a Chinese medicine practitioner. One of the reasons being is that at night, your liver helps detoxify the body, it helps regenerate for the next day. And if you're up late, you're then kind of giving your body other functions rather than being able to rest and repair. And 11 o'clock is the liver time. So we say get to bed for 10:30. You can still be watching a movie for a little while, but at least if you're resting, your body can then do its jobs that it would during the night. And also, it's about getting a decent number of hours. Emotional health is also important. And if you've had issues in the past, you might have had traumatic events happen to you, you may have had miscarriages, there may be lots of different things that you've experienced and that you may feel are affecting you. And now is a good time to address those before going into an IVF cycle if you've got the chance. If you're a worrier, trying to find ways to switch your mind off and stop that overthinking will really help you. So building in a practice of mindfulness or meditation, or some kind of activity that occupies your mind, like knitting, whatever it may be, that switches you out of that thought, use those to help calm your mind. If you've got issues around grief or fear, maybe working with a therapist if you can to address those, because IVF is an emotional process as well, and we want your emotional health to be as good as possible. Stress, worry, emotional stress, try and bring more kind of love and joy into your life. So go for hobbies and things that are going to really excite you. We can get stuck in the mundane and almost forget how to have fun sometimes. So bring in things that will help, make you feel happy having fun. Bring out that inner child if you can. Frustration, if you've got a lot of frustration and anger and feelings that you're suppressing, try and get them out. Again, exercise is really good for this. Boxing, if you've really got lots of pent-up aggression that you need to get out of you, do what you can to work on your emotional health. And also be creative, because sometimes being creative and making things happen can really help get things moving on an emotional level. Also, look at your environment. So I'll talk a little bit more in detail about this later, but what are you being exposed to? What is your living arrangements like? How can you make those things as healthy as possible for you? And then, now is the time, if you are preparing for an IVF cycle and you want to do acupuncture, to start looking for an acupuncturist so you're ready and you can start the ball rolling.
And thank you so much, Laura, for the thorough answer to this question. Excellent. Thank you so much for all the tips and advice. And let's have a look at the next question as well. So, how can acupuncture help with ovulation issues in preparation for IVF?
So, ovulatory dysfunctions are one of the most common causes of female infertility, and a large percentage of those are PCOS. And acupuncture has a lot of different effects on the body, one of which is increasing the blood circulation. So if we can increase the blood circulation to the ovaries and the uterus with acupuncture, then we can have an effect on things like inflammation in the ovaries. So often you'll see that the ovaries are quite enlarged, and acupuncture can help reduce the size of the ovaries. If you've got a lot of ovarian cysts, again, this movement that acupuncture creates can help work on those cysts and help reduce them. With polycystic ovary patients, particularly those who have the full syndrome, they'll often have insulin resistance. And we know that acupuncture reduces the insulin in the body by decreasing the blood sugar. And one of the things that we have to be conscious of as acupuncturists is if we're treating people with type 1 diabetes, that their blood sugars don't drop too much when we're treating them. And I've seen that happen quite dramatically. And so we know that it really does have a very effective response on this. Also, it works on the sympathetic nervous system. It works on the endocrine system and the neuroendocrine system. So it helps regulate the hormones. It helps regulate your endorphins, your stress responses, all of the factors that will influence ovulation in the body. One of the things we try and do is regulate menstrual cycles. So depending on the severity of somebody's ovulation issues, it may actually be that we can get a regular cycle going that can even enable natural conception prior to an IVF cycle. So if you've got the time, giving that opportunity, might get you the result that you want anyway. If it's more severe, the aim is just to get your cycle as regular as possible, because if we can get your cycle regular, your body is going to be in a much more balanced state and therefore will respond more favorably to the medication because it's already halfway there. One of the things to point out is that acupuncture is dose dependent. So being conscious of your ability to go frequently is quite important. As acupuncturists, one of the things that kind of makes us sad is when people get in touch and it's just too late for us to help them. Sometimes it's because we're just booked up and we don't have the ability to fit people in, but also that we just don't have enough time before they start a cycle to do the preparation work that we would really like to do. So being conscious of that, if you are thinking about doing something like acupuncture, getting in touch as quick as you can, because you don't have to go and start treatment straight away, but you can get those appointments booked in that are going to give you the right amount of time to give it its best chance. And there's been research that has shown that acupuncture significantly improves the birth rate of subfertile patients undergoing IVF and ICSI. So I think that alone is a good motivator to go and give that preparatory time before you start an IVF cycle. There was another piece of research from China that also showed that the birth rate was 52% with acupuncture, where the sham group and the control group only got 30%. So the statistics that we are starting to see from research are quite significant.
And excellent. Thank you so much once more for explaining this to us as well. And let's have a look at the next question. I've had an HSG which has shown I have blocked tubes. Is there anything I can do to help prepare?
So we know that blocked tubes don't affect IVF. The IVF will override a blocked tube. But if you've had a HSG and what I would say is try and get as much information as possible, because sometimes the tubes are blocked because there is a lot of scarring and damage to a tube, but not always. So if you find out that the tubes look blocked, but they can't see any significant scarring, or if you find that there's a minor blockage at what we call the proximal end, which is the end closest to your uterus, then it might be worth considering having a course of acupuncture before you do the IVF. It might also be worth considering things like abdominal massage. The reason being that about 60% of people who have a HSG and find that they have blocked tubes, later find that they've cleared. And one of the reasons is that sometimes the tubes can just spasm, and stress, tension in the body can also create those spasms in the tubes. And also they can just be blocked with excess mucus. So when we look at patients and we look at their constitution, sometimes we'll see that that person is quite damp or has a lot of mucus in their body. Me, for example, it's hay fever season and my sinuses will block up. So I am prone to what we would call phlegm damp in the sinuses. So from a fertility point of view, if we see a patient has a lot of phlegm damp in their body, we can use the acupuncture to help relax the body, get the liver energy moving so that those tubes relax. And we can tonify the body and move that phlegm damp. And it might be, if things are pronounced, that we even use herbs to do that. So it may be that the opportunity is there to clear those tubes and also, produce a natural pregnancy. If that doesn't happen again, it's just putting you in a better state, ready for IVF. And I have had patients who have had blocked tubes and been told that they can't conceive naturally before an IVF cycle. So I have seen it clinically as well.
And perfect once more. Thank you so much for that. And let's have a look at the next question. So we are having ICSI. Is there anything we can do to prepare?
So again, male fertility is really important. First of all, we have to find out, are there any structural abnormalities that are causing the male fertility issues? Because if there is a structural abnormality that is maybe congenital, like the vas deferens has never formed properly, then we can't help that. But a lot of cases where sperm parameters come back abnormal, they can't find a cause. And also you can have what's called non-obstructive azoospermia, which means that there isn't anything blocking the route out for the sperm. There's nothing in the way that is visible that is kind of impeding that sperm production. And in those cases, it's worth considering things like acupuncture and herbs as well. From a lifestyle point of view, all the things I spoke about earlier in terms of keeping the alcohol consumption as low as possible, looking at your work environment. Are you being exposed to any chemicals during your work? Do you work in a very hot environment? I see a lot of engineers who work in the engine rooms of ships where it's very, very hot, those kinds of things. So anything like that, trying to change the situation so that you can improve it. Are you exercising? Again, thinking about insulin resistance. A lot of fertility medicine is very much focused on the female, but a lot of the things we see in female fertility also happen with men. Has your thyroid been checked? How stressed are you? Dealing with that emotional side of finding out that there is something going on with your sperm is just as important, because we know that actually high stress can impact all factors of male fertility. So looking at mindfulness, anything you can do to relax, building that into your lifestyle is very important. Another key thing I really like to talk about is varicocele. The reason being is I see often in practice that the testicles are not getting checked. And this is really important. Currently, the NICE guidelines in the UK do not kind of encourage varicocele treatment, but there are some fantastic urologists out there who are working towards changing that. And I think it's important for men to know that varicoceles are very common. So they're found in about 15% of men in the population. And basically what they are is a bit like a varicose vein, but in the testes. If you have fertility issues and you haven't had your testicles checked, then I would say please do go get them checked by your GP. If you visit your GP and they find a varicocele that is obvious, then try and get referred. Most GPs that I've worked with do follow through with treatment where it's appropriate. The reason I'm really passionate about this is because the research really does show that treating a varicocele helps on all levels. Even if you have good sperm parameters and you have experienced recurrent miscarriages, or your partner is just not getting pregnant and you've been trying for such a long time, or you've done IVF cycles and everything looks good on your sperm, but then when they come to fertilize, either you have less than the expected average of embryos fertilizing, or you end up at the end of the day with very little left. It's really worth investigating this, because what the research shows is that when a varicocele is treated, everything improves. Even in patients whose sperm parameters have been normal, they've seen improvements when there has been treatment. So across the board, it's really worth investigating. Now, I'll grab my notes. There was a piece of research that I read, and I noted this down because I just find it kind of mind-blowing. But basically, in men who had their varicoceles treated, they saw 12% higher fertilization rates, 15% higher live birth rates, and 9% fewer miscarriages. And for me, to see data like that is enough alone to kind of confirm my opinions around getting varicoceles treated. Acupuncture can also help with these things on a circulatory basis, but I do always encourage my patients to have those investigations done. Also, herbal medicine can help, because if there is poor blood flow, we have really good herbs that can work on that. Sadly, the research is really lagging behind in male fertility, but I really hope in the future that more research will be done and we can kind of start to show the benefits of what we do around these treatments. But acupuncture also is going to help boost circulation in the testicles. It's going to help boost your general health. It's going to help relax you with any stress or emotional problems around male fertility. It's going to reduce insulin resistance again, if you're having problems with that. It's also good for any erectile issues, ejaculatory issues. These have all been proven through research, and it helps boost testosterone. It also reduces cytokine levels, which can also affect sperm quality. And if there's immune factors going on in either side, then acupuncture can also help with that, and various herbs that we use. So I would say, in preparation for ICSI, if you can, address as many lifestyle factors as possible. Find out if you've been checked for varicoceles. If not, and you've got the opportunity, it's worth looking at that, particularly, like I say, if you've had recurrent problems or recurrent failed cycles where it indicates there may be something going on there. And then try and get some acupuncture.
And once more, thank you so much for a thorough answer to this question, indeed, as well. And let's have a look. There are two questions left. The next one is, I have endometriosis. What would you recommend in preparation for IVF?
So again, with endometriosis, looking at your diet, lifestyle, and similar to PCOS, endometriosis is very estrogen dominant. So looking at environmental factors, trying to reduce any chemicals that you're exposed to. So that is in the diet again. So when I speak about things like good quality milk, finding milk that maybe hasn't got as many hormones in. So, you've got your average milk on the shelf, you've got your organic milk, then you've got what would be classed as your A1 and your A2 milk, and your better quality milks are the ones that come from grass-fed cows or goats, or going dairy-free is the next option. And obviously we've got a lot of really good dairy-free options available now. So I would explore that to reduce the hormones that you're being exposed to. And again, the meat quality that you're eating, that could potentially have hormones in it. And like I said before, if your condition is particularly serious and you're not sure where to go with diet, then looking at a nutritionist is a really good idea. Also looking at the products, the chemicals that you're using in your home and on yourself. So one of the kind of mild anxieties I have at the moment is all the disinfectants we are using amid COVID. And there's not a lot we can do about that other than maybe explore the options that are going to kind of reduce the number of side effects and side products that come from these disinfectants, because some of the byproducts that are produced can have negative impacts on our body. And these chemicals become what's known as endocrine disruptors. So they disrupt how your body is responding to hormones. And that's exactly what we don't want when we've got a situation of hormone dominance in the body. So looking at natural cleaning products, natural cosmetics, getting everything as natural as possible and reducing your chemical exposure will really help on that side of things. Also, gut health in general for everybody is really, really beneficial, but particularly if you have an estrogen dominance. So making sure that you're having good quality, regular daily bowel movements. And if you're not, addressing that either through a nutritionist or looking at what diet changes you can make to improve that. Are there maybe foods that you're eating that can be inflammatory? So obviously, you hear a lot of things these days about people being gluten intolerant. And what I would say is not everybody necessarily has a medical issue around foods like gluten, but they are difficult to digest. And just because it creates some difficulty in the digestive system doesn't, make it okay if you haven't got, like celiacs. If you're eating foods and your digestion is bad and you're having bloating, taking away the foods that are difficult to digest on the digestive system will really help. So reducing things like gluten, taking away dairy where possible, can really help calm the digestive system down. And then looking at things like probiotics, prebiotics, digestive enzymes. Again, this is where working with a nutritionist can really come in. But addressing as much as possible to get your digestion as healthy as it can be, so that you're going to excrete any excess hormones in your body. Because if you're not having a daily bowel movement and your body is producing lots of estrogen, there's nowhere for it to get out. So then as your body produces more estrogen, it just adds to the estrogen that's already there and it becomes a vicious cycle. So gut health is really, really important in fertility in terms of balancing hormones. Other things to look at is kind of pain management with endometriosis, and controlling, how that is affecting you and how it's affecting your menstrual flow. So again, looking at things like abdominal massage, and you can teach yourself self-abdominal massage, or hopefully when things calm down with COVID, you can look at kind of integrating things like that into maybe, your life, and they'll really help. Because anything that's going to get the circulation going in your body is beneficial. But also, if you've got a lot of scarring inside from the endometriosis, it can change the structure of everything inside. And what we really need is for things to be as aligned as possible so that, your blood flow can move properly. And sometimes that scarring and the pain that is created from the endometriosis can really affect how things are aligned. So if you imagine your muscles in your body are really tense and you've got pain on one side, you're going to change your position. You're going to develop compensatory patterns within your body. So anything that can help release that tension, the same way if you had an injury and you injured your back, you might then start to walk funny and you end up having to need a massage or physio to help get your alignment back. Think about that on a monthly basis when you're having very severe periods. Anything that's going to reduce your pain, relax those muscles is helpful. Also looking at things like castor oil packs. There's loads of information out there on castor oil and how you can use it. And it can be quite beneficial for the pain of menstrual periods. So that would be something worth investigating as well. There are also supplements that can help with inflammation. Like most people have heard of turmeric these days. So incorporating foods and supplements into your diet that are going to help reduce any inflammation can be beneficial. We also know that women with endometriosis often have an excess of what we call peritoneal fluid. And that tells us that there is potentially like an environment that isn't healthy, and could be infection there can be immune reactions going on. So all of these things that get things moving will help clear that. And that again is where acupuncture comes in, by boosting the circulation. It's also really good for pain relief. The research is very clear on acupuncture for period pain, dysmenorrhea. So using acupuncture, again, we can use herbs to manage conditions like endometriosis, and I would bring fibroids in under this umbrella as well, in terms of how they impact the body. Sometimes it depends on the severity of these conditions as to how much we can do, but we can generally manage the severity of them and prevent them getting worse, and also help control the pain. And then also through that balance of the endocrine system, help balance the hormones out so they are being less stimulated, and in that way maintaining the condition in a better state. Also, there are things out there which you might have read about. There are medicinal mushrooms that can be used. Again, I would really recommend, if you're interested in these things, reading about them and then finding a well-trained herbalist who can prescribe these for you, because they can be very specific in their actions and not all of them suit every situation. And also it may be beneficial to have particular blood tests around that to decide which ones are the most appropriate ones to use. I think that's it.
All right, excellent. Thank you so much again for that. And well, now it will be our last question when it comes to those most common ones. And of course, we will go for your questions. There are pretty a lot of questions already. So let's get to it right now. So how acupuncture can help before or and after the embryo transfer?
So this is an interesting one, because a lot of people focus on the transfer day, and really, yes, it's important in terms of, this is the big crescendo, this is what we've worked towards to get these embryos in your body. But the most important stage is the preparation stage and the stimulation stage of an IVF cycle. Getting enough treatment before you get to embryo transfer is really, really important. And I would say, without a doubt, the stimulatory phase, if you're having a full IVF cycle, is really the more important stage. In terms of before and after embryo transfer, before transfer, we do a lot of work on relaxing you, calming your mind, preparing you for going to the clinic to have the treatment, because obviously it's a big deal. It's a very stressful day. But also we use points that help relax the uterus, so it makes that transfer easier. Again, we're using points that are going to help boost the circulation, ready to kind of nourish that uterus and accept an embryo. After embryo transfer, depending on the day of your transfer, the actions of the acupuncture change. But again, it's about keeping you relaxed. It's about getting the circulation going to help give sufficient blood supply to the uterine lining, to help an implantation, to help that, embryo bed into you. Regulating the hormones so that your body's response is appropriate to that embryo that's been implanted, and then just relaxing you, ready for the 2-week wait, which is obviously again the really big roller coaster ride.
And thanks once again for answering this question, and of course for answering all the questions. And well, Laura, as you can see, there are plenty of questions ready from our patients. Are you ready to start with them?
Yeah, sure.
Excellent. Happy to hear this. So let's have a look at the very first question. So, hello, you help with fibroids regarding acupuncture?
So with fibroids, it's a similar way to what I've described with endometriosis. With fibroids, we've got an accumulation within the body of what we would describe as blood stasis. So often fibroid patients have very heavy, painful periods. So we would address those with treatment, trying to get the period flow to a more manageable level, because if you have very heavy periods, then it's going to affect potentially your body's resources, and can lead to things like anemia. So we want to counteract those factors. It's also the pain side, the pain management, making your life more comfortable. Again, the hormonal balance, because again, fibroids are generally, responsive to estrogen. So we want to make sure that your hormones are as balanced as possible to try and kind of discourage those fibroids to grow, and just making that environment as healthy as possible, ready for, conception.
Excellent. Thank you so much for your very first question and, of course, helping out with this as well. And now we have a question in regards to supplements. So I am taking vitamin D, vitamin C, folic acid, and complex vitamin B. Is this okay? And also there's another one in regards to Q10.
So vitamin D, I think, is a pretty unanimous one these days. It's recommended in terms of fertility for both male and female. I'm not a nutritionist, so to talk about supplements on a deep level is really beyond my expertise, and that's why I often refer to a nutritionist. The key things to look at are your dosages, making sure that you're not excessively dosing. Everything you've listed is what you would find in, a good conception multivitamin. So I would say they should be fine. What are the dosages that you're taking? Are they within safe levels? If you're unsure, maybe, exploring that with a nutritionist would be a good idea.
Oh, of course. Thank you so much. And actually, there is another question in regards to this as well, because it's regarding supplements. Okay, so let me read it out. Of course, I take Pregnant Care Vitamin D. I'm not sure. Sorry, 500. Okay, 500 milligrams, omega 369, and also going to start taking CoQ10, 200 milligrams. Is there anything else that would help? I am hoping to naturally trying to conceive and also considering donor egg.
Yeah, so, I can't make recommendations without having somebody's full case history and knowing what is going on with someone. And really, what I generally do is I give my patients information sheets that I have from the nutritionist that I work with, and from kind of sources that I have confirmed. And then, if they need to explore it on a deeper level, then I will signpost them to the appropriate professionals, really.
Of course. Thank you so much. And I guess, anyone, if would like to get in touch with you, you will be able to connect to someone with a nutritionist, right? That
Yeah.
you cooperate. Exactly. So I will send you a link in a minute, so you will be able to do that, of course. And well, there's another question. If you could take a look, I have heard pomegranate juice is good for your blood flow to your uterus for your lining. Is it good? Is it good as well?
So I don't know. Again, this is the big nutrition field. What I would say is it's not going to do you any harm to have things like pomegranate and grapefruit juice. Grapefruit juice, you have to watch if you are on any kind of blood thinning and heart medications. So just checking that you haven't got anything that's going to interact with things you're taking is very important. There's really good websites out there now as well where you can check interactions. But if nothing else, you're going to get lots of vitamins. Foods like pomegranate that are that darker, redder colour generally are rich in antioxidants, and they are very good for fertility health, for reducing cytokines, generally boosting the body. So it's not going to do you any harm, whether it's the panacea. I kind of joke and I say, did anybody really never get pregnant because they didn't eat an avocado? I think we get a little bit too hung up on the nutrition sometimes, in the idea of maybe I should eat this, I've read this. When I first started on all the forums, they would always talk about peas. you shouldn't eat peas. And, you know, like if peas were really why people weren't getting pregnant, I think we'd have a much bigger issue than we do have. I think just eating really healthily, eating good whole foods, good quality foods, and then if you want to take it to a deeper level, exploring it with a professional, because what they will do is they will do tests and they'll see what your actual nutrient levels are, or they'll see where your hormones are at, and they know what foods will balance those out, is much better for you. And I think it's really important that we don't let the food consume us. A lot of patients become almost caught in this trap of really wanting to do the best they can to help themselves. And food is a great way to do that, because you can channel the energy of wanting to do something into cooking and making nice food, but it's not going to the extreme of worrying at every little thing. Is this right? Should I eat that? Shouldn't I eat that? Because then that becomes an extra stressor, and that's really not helpful. You know, and I have patients who come in and they'll say, oh, I've had a bit of cake. And I'm like, you know, your IVF isn't going to fail because you've just had a bit of cake. You know, just don't worry too much. Do the best you can. And also, there isn't a lot of evidence. We don't have loads of research around these things to say, yes, you must eat that. So just do your best and don't worry too much, is what I'd say.
All right, excellent. Thank you so much for that advice, of course, as well. And let's have a look. Of course, there are more questions coming up. So, should you still limit the caffeine to tea because of tannins?
Like I say, the research around tea, some pieces will say things like caffeine is okay, some will say it's not too bad. And again, it's coming back to this idea of, well, you know, how many things are you going to cut out of your life? How comfortable are you with that? A lot of people get to a point where they feel like their life is on hold because everything is focused on getting pregnant. And I would say I don't think a couple of cups of decaf tea is really going to be the thing that you need to worry about. And, you know, if you think about something and it does make you question it, maybe that if you do drink decaf tea, are you going to stress about the fact that you had decaf tea? Then you may be better going for a herbal tea, or, you know, looking for an alternative. But it's finding what's the right balance for you, you know. On the other side, if you cut out decaf tea and you can no longer have tea in any form, and tea is something you really enjoy, then you're probably better just having a couple of cups of decaf tea. Because I think we do get really focused on all of the things that we can do to make ourselves as healthy as possible. And then we forget about the stress that those things can cause. So it's really about trying to find that balance as much as you can.
And once again, thank you so much for explaining this as well. Now, let's have a look at the next question, a bit longer one. I started the birth control pill to be able to plan my trip for IVF. Due to delays due to coronavirus and me gaining weight, I thought I'd stop temporarily with the pill and start again in July and hope to do IVF in September. Problem is that I quit the pill mid-cycle 35 days ago, but no period yet. What shall I do? Can Chinese herbs or anything else help me get my period back so I can start the pill again ASAP?
So my question would be, why were you on the pill in the first place? You know, you're not normally kept on the pill for too long. It depends on where you're having treatment as well, but most clinics will only have you on the pill for a few weeks before starting an IVF cycle. So were there any underlying issues that resulted in you going on the pill in the first place? Secondly to that, the pill has an impact on the body of affecting ovulation. It stops ovulation. So when you come off the pill, your body has to rebalance, and that can sometimes take a little while. So I would say, first of all, try not to stress, because it's not been too long yet. How long are your cycles normally? You know, some patients come and they have just stopped birth control, and you'll see that all women respond differently to birth control pills. Some people can go on the pill and come off and straight away their periods will return. Other women, their periods really struggle to return. So it does have varying impacts on different people. So give it a bit of time. The things that are going to get your energy moving and are going to boost circulation and help with ovulation are things like exercise, reducing your stress. Acupuncture can help. Again, things like that self-abdominal massage. And if it does get to the point where it's dragging on, then get some blood tests maybe. Definitely acupuncture and Chinese medicine can help you in these situations. It's just difficult without full information to, give you complete advice.
Of course, I just wanted to show you, yes, that of course there's a follow-up from the patient. To plan the IVF trip, to answer your question, was due to be on it for 2 months before IVF, no underlying issues, and also I'm really stressed. 24 days normally. I am 41, so can't delay IVF that long.
So I would try and get in contact with your clinic and, relay the stress that this has caused and see what they can potentially suggest for you, because they might be able to say, right, go and get these bloods done. It's really hard with COVID and knowing how people are working at the moment. But yeah, definitely seek help if you can, and see an acupuncturist. These are things that we work with on a regular basis, and hopefully you can get your IVF soon.
Yeah, exactly, of course. So we are definitely keeping fingers crossed for you, okay? And Laura, thank you so much for that advice as well. Okay, and let's have a look. Of course, there are more questions coming up. So I plan to do acupuncture weekly 4 weeks in advance of my frozen embryo transfer, and then right before and after my transfer. Is this enough?
So again, it's a difficult one, because without knowing somebody's full history, you can't say what you would ideally do in a situation. I would say, if you've planned to do 4 weeks, then that's what you have available and you're doing the best you can. In a frozen embryo transfer, most of the work's already been done in terms of getting that embryo ready. So there's less work to do. So I think you've made a good plan. Depending on somebody's history, if they had a more complex history, then ideally, if they haven't had treatment before, we would try and see people for 3 to 4 months before they do any kind of IVF treatment. But we know in reality that isn't always possible. So what you've done sounds, pretty good.
And again, thank you so much for this as well. And next question is ready here. How can acupuncture help with equality during an IVF cycle for older ladies? When is the best time to have it during the IVF cycle?
So with egg quality, again, this is a really difficult one, because it's something that's very hard to research. And in kind of fertility medicine, we're still learning a lot about what we can do around helping egg quality. We've got lots of information out there of things we can try, but there isn't necessarily a huge bank of information about what is, yes, that definitely works. We do know, though, that acupuncture helps improve the blood circulation to the ovaries. It helps balance the hormones. So the impact that acupuncture has can improve how those eggs are then kind of go through the follicular process, how they respond to the medication, how they're released throughout your IVF cycle, and how they are then, kind of collected and developed into embryos. So just the acupuncture alone, the way it works with the blood circulation, hormonal regulation, endorphins, those kinds of things are really going to help try and get the best. Again, in an ideal world, it's having that preparation time. For older ladies, it's really difficult, because there's that ticking clock, and it's how long are you prepared to wait before you do IVF? And again, it's down to individual situations, because Some people, there really are, their consultants are saying, we've got to do this now. But then some patients, they may be in the older bracket, but actually their blood test results, their scans, the number of follicles they're producing are really not that severe. That if you're only producing 1 or 2 follicles and you're only getting 1 or 2 eggs, then time is more of the essence. So I would say, as a rule of thumb, 3 to 4 months, because that's the length of time that it takes for follicles to be generated, is always the ideal. And the same with sperm. It's a 90-day process for spermatogenesis. So wherever possible, we're going to try and get at least 3 or 4 months before you start an IVF cycle. But we'll always work with what we've got. And then having good regular acupuncture throughout an IVF cycle is the ideal.
Excellent. Again, thank you so much for this. Okay, and let's have a look. Of course, there are more questions, of course, coming up. And let me go to the next one. So, are there any risk of using Chinese herbs during IVF?
I would say this is a funny one, because I generally don't prescribe herbs during IVF, purely because we need to see how the body's responding to medication. And herbs are very good during IVF if needed, but it's very much, let's leave that as a last resort and do the work before you have the medication. And in my practice, I've found that I rarely need to use the herbs during an IVF cycle, because usually we've managed to get the things done that we want before you have the medication. Also, clinics in the UK really don't like patients to be on Chinese herbs. I think there is a lot of fear around Chinese herbal medicine, because really there just isn't that education out there for the medical professionals to know more about it. I would say there's always risks to some extent with things that you take. The main risks being that if the herbs are just not the right combination, we do very complex diagnosis in Chinese medicine, and the real skill is getting that diagnosis spot on to pick the correct ingredients that we put into the formulas that we make. So there's the dynamic of herbs with IVF drugs that could be the wrong balance. So it's about having a practitioner that you really trust, and someone who's really, really experienced with herbs before having herbs during IVF. But herbs in general are very safe as long as they're prescribed correctly and used within the correct dosage ranges, and then the patient takes them correctly.
And of course, again, thank you so much for the clarification to this question. Next one, can you take Chinese herbs with other supplements like CoQ10, VITEX, vitamin ED, folic acid?
Yes, you can. Again, what a practitioner would do is review all of the supplements that you're on. They would then plan the herbal medicine that they wanted to prescribe and check that there are no interactions. So there are certain herbs and supplements that we wouldn't combine. We do use VITEX in Chinese medicine as well. So if you were taking VITEX, you might be asked to stop it, because it might be already something that practitioner is going to incorporate into your formula, and you don't want to double up. There are certain herbs, for example, that interact with things like B6. So we would always check what you're taking before prescribing and alter things as need be.
All right, excellent. Again, thank you so much for this. And well, next question is also right here. I live next to a substation, power station with a lot of electrical poles as well as a highway. What would you recommend doing other than moving, which could optimize my husband's as well as my own health to counteract possible effects of environmental damage?
I have to admit, this is way out of my expertise range. I honestly don't know what I would recommend in this situation. I'm sure that there are people in my network who would have the answers for you, though.
Of course, okay. So again, you can use the link there, of course, that I have added, and I'm sure Laura will be happy to connect you with someone that will be able to properly answer this, right? Thank you so much. Okay, let's have a look at the next one. So, is it okay to take DHEA alongside other supplements to improve egg quality and uterus health regarding thicker lining?
Again, DHEA is a funny supplement. It's not something that I would ever recommend a patient to take. Again, because that is outside of my expertise. It's also something that it needs to be monitored. So if you are wanting to take DHEA, I would have that conversation with a consultant. Some clinics are very pro DHEA and they will monitor their patients while they take it. Others don't recommend it, and it can have side effects. And I have seen both sides of the coin in my patients. I've seen patients who've responded beautifully on DHEA and it's had a really good response when they've taken it. I've seen other patients who the kind of effects on the androgens and the testosterone have been too negative, and they've had dramatic skin changes, hair changes. It's really affected their mood dramatically, and in some ways have had much more negative effects. So some of the information that I give out to my patients comes from other IVF clinics and their experience and what they've seen around those supplements. So I would say speak to the consultants you're working with and just get as much information as possible on using DHEA before you make that decision.
And once more, thank you so much for this. Okay, and let's have a look at the next question. Can men with sperm issues, morphology, and motility benefit from acupuncture?
So, like I said earlier, it really depends on why they have sperm issues and if it's, a congenital issue. Um, is it a factor that can be changed or not? Is it unknown? If it's non-obstructive or we don't know the reason for why those issues are there, then I would say yes, it's worth trying for sure. I use herbs mainly when I see sperm issues, because they tend to, for me, in my experience, get the best results. And one of the things that I think is important to note with sperm is that what I described before, where some men can have normal sperm parameters, and it may be that there's DNA fragmentation that we don't know about, and varicocele treatment can help with that. It's the same with herbs. So I've seen clinically men who have issues with their sperm, and on paper, the changes don't occur. So it may be that their count hasn't changed, particularly with morphology, maybe their percentage hasn't risen, but we see a pregnancy occur. So I think sometimes there are things on a much deeper level that we're not aware of, that we can't necessarily measure, that it does have an impact on. So yes, definitely there are things that we can try and do. It's whether, there's structural issues or not that are affecting it.
All right, again, thank you so much. And actually, there is another question. Okay, sorry, just need to find it. Okay, here it is. So, when should the male partner start or do a session of acupuncture before IVF cycle?
So this will really depend on the history of the male partner, whether there are any known factors involved, the history in general, whether you have had signs of conception previously that hasn't progressed, if you've had a history of miscarriages. We would delve into that, and that would really give us a clue as to whether there's maybe some hidden underlying issues and how much work we may need to do on the body. But as a rule of thumb, it's that 3-month mark that we ideally go for, because then we've got enough time to influence the sperm that are going to be produced for the IVF cycle. So 3 months is always the magic number. If we get any longer, then we're jumping for joy, because potentially we can help patients conceive naturally given the right circumstances. So it's whether people have got the time, whether they're willing to wait long enough, to give us that chance, really.
All right, again, thank you so much for explaining this once more again. And let's have a look. Of course, there are more questions, and actually this one, it's interesting. Are you in London? If not, can you recommend any acupuncturist?
I'm not in London, I'm in the northeast, but I know a lot of very good acupuncturists in London. So just get in touch and we will send you the details.
Excellent. Thank you so much. And of course, the link is in the chat section if you would like to get in touch with Laura and get to know some other ones in London. That will be, I'm sure she'll be able to help you. And well, another question, is preparation for donor transfer any different to a full IVF?
Again, it depends on the individual, because okay, you're having to have a donor egg, but how's your general health? And we can still glean a lot of things from what somebody's menstrual cycle is like, what their energy levels, their sleep, their stress. We'll look at all of those kinds of factors to just make sure your body is in the best position possible. Also, we want that endometrial lining to be as good as it can be, to have the best circulation so that it helps with implantation, it helps with placenta development, and those things will help go on and support an early pregnancy and potentially reduce the chances of miscarriage. So where you can, getting some preparation work in is just as helpful.
And excellent. Thank you so much once more for that. And next question is, I'm taking dexamethasone. Is that a blood thinner?
I don't know. I'd have to look that up. I'm not
Okay.
familiar with that product.
Of course, not a problem. Again, I'm sure you will be able to double check it, and we will be happy to simply forward this to you as well. Yeah. Okay. Let's have a look. Okay, at this one then. Is there a recommended amount of acupuncture sessions to be effective? Is it effective after a few months?
So acupuncture has a cumulative effect. So what that means is the more you have it, the more the benefits build up. How many and how often you need it to be effective will again just depend on the case. So say for example, I have a patient who has amenorrhea, they're not having any periods at all. I'm going to want to see them at least once a week so that I can give their body as much work as possible to get the wheels in motion, to get their menstrual cycles going again. And they come in and we look at their general health, we look at their basal body temperature charts, and maybe I see something like their luteal phase is a bit shorter than we'd like it, or their ovulation is not quite as smooth as we'd want to see. And I'm going to target the treatments around the points in their cycle that I want to have impact, and they can have it less frequently. The kind of length of time will again depend on how complex the case is, and what's going on to start with. One of the things that we have seen is that there's a huge peak in conception, particularly with patients who are trying to conceive naturally around the 3-4 month mark. And so it just echoes, what we know about follicular genesis, spermatogenesis, that it all takes 3 months. And so having that 3-month, time period can be a really good guide. So for most patients, I would say just always start with that in mind, 3 or 4 months. Your practitioner will give you a much more detailed explanation of their expectations and where they think you might need to go, but it's very much individualized.
Okay, excellent again. Thank you so much for this. And actually, there's another question on what's your advice on continuing acupuncture after embryo transfer for the first 2 weeks?
Yeah, I would recommend it. Embryo, the 2-week wait is a really difficult time for patients, emotionally, and acupuncturists are there to support you. They're part of your support team. They have got a wealth of information that they can share with you during that time, but also we can take into account your previous history and use the treatments to help support you in that stage, to encourage implantation, to encourage pregnancy to occur, and to help support early pregnancy. So there are certain things that we see in patients that will then tell us the potential issues that they may have as they move forward with the pregnancy. So sometimes it's quite difficult because I might have a patient who is pretty young, fit, and healthy. They've done an IVF cycle. We've got them pregnant, and that they'll get in touch and they'll say, "I'm pregnant," and you say, "Great, I'm here if you need me." And sometimes you don't want to be kind of seen to be pushing acupuncture on your patients. You don't want to be saying, "Yes, keep coming, keep coming, keep coming." And patients are very confident, particularly when they're younger, that things are going to be okay. And it's an awful situation to be in when you really want to help and support somebody in those really early stages, just in case, and then they don't come and they do miscarry, and you've got to then help them through it again. So I would say, if you've got a good relationship with a practitioner and you're feeling really good benefits from your treatment, trust your practitioner and use them as much as you can through the 2-week wait. And then if you are successful, stay with them until those points in pregnancy when we know that things are good. Because miscarriage is common. It is higher in cases like IVF. So doing what we can to support you is our job, and that's what we enjoy.
All right, excellent. Again, thank you so much for that advice. And there's another question. There are a few questions left, so of course we will be slowly finishing. If you have any questions left, this will be like the final call for those questions. And the question is, can you do acupuncture and reflexology, together, or is it better to one or the other?
I work a lot with patients who want to combine therapies. And so what I would say is, if you have therapists that you enjoy seeing and you want to add something like acupuncture in, then speak to your reflexologist and speak to the acupuncturist. Some practitioners have differing opinions and they don't like their patients to combine therapies. What I tend to do is, particularly if patients are seeing therapists that I know well, we'll get together and we'll plan our treatment. So, for example, I work with a reflexologist, and sometimes what patients will do is they'll see their reflexologist one week and their acupuncturist the next week. Or there may be situations where we've had it before that they've gone, "Oh, well, I'm going for my reflexology and then I'm just going to go for my acupuncture like straight after." And we've had to say, "No, that's really not a good idea. That's too much. Let's schedule it and we'll plan it for our patients." And so I might say, "I really want to see this patient at this point in their cycle. What are your thoughts and what are you trying to achieve?" And then we'll plan it together to give the best benefit for our patients.
And excellent again. Thank you so much for that. And let's have a look at the next question. Sorry, it's right here, of course. What major ingredients should one look out for and avoid in cleaning and cosmetic products?
So again, I'm not majorly up on this, but it's things like parabens. There's loads of information and research out there, and there's lots of natural products that you can find quite easily in the supermarkets these days. I love to mention names because some brands have been bought by huge corporations, and people will kill me for saying things like Method, but you can find things like Method products out there. Just do your research. If it's a standard cleaning product, it's likely that it's going to have chemicals in it that could potentially affect you. It is a bit of a rabbit hole that you could go down, but even bleach can have an impact on the body, the ammonias, those kinds of things. Sorry, I can't be more helpful. I'm not good at remembering names of things like that.
It is okay, of course. Still, thank you so much for that question, and of course your advice to also research it. This, of course, yeah. Okay, and let's have a look at the next one. You mentioned a healthy gut health, but would eating lots of kimchi help? What about kefir? Can that also be good enough, even though it is dairy?
Yeah, so fermented foods can be great. I did some training with a guy who is really, really into this a couple of years ago. And what I gleaned from that was that basically you have within your body your natural bacteria who are, your little family that live in there. And sometimes they'll get out of balance. And things like kefir and kimchi, because they are made up of I can't think of my words today, like a culture of bacteria. It's not just one strain of bacteria. They're generally really good. And so what they will do is when you eat them, they will activate the bacteria that naturally live in your gut because they like to own your gut. And so they'll then go, hey, get out, right? I'm going to multiply. So by eating cultured bacteria, you're helping encourage the healthy growth of your own gut bacteria. What I would say is from personal experience, you have to play around with things like this. And again, this can be maybe where a good nutritionist can come in, and they can even do stool sampling if you're having a lot of issues to see what is out of balance within your gut. But not every kind of probiotic food will suit everybody. And it's about getting balance and not having too much. So I went through a big kombucha phase and I really overdid it on the kombucha. And so I actually had a negative impact of just knocking my gut out of balance even more because I'd gone the other way too much. I think in all aspects of nutrition and health and diet, it's about everything in moderation. Don't go kimchi crazy, but yes, have those fermented foods. They're very good. If you have issues where you want to avoid dairy, you can have water kefir, and that's a really simple one to grow at home. You don't even have to really make it very complex. You can use very small amounts of sugar to grow it, or you can put things in to flavor it like lemons and apricots, and it has almost like a lemonade taste. Water kefir is probably one of my favorites to use. So there are other non-dairy options. You can even grow kefir with milk alternatives. I think you just have to rotate it every so often and let it culture in some dairy to kind of recoup. But it's about balance. And again, always just seek professional help if you're not sure. And if you notice symptoms changing, or your body not necessarily responding particularly favorably to one fermented food, then maybe your culture in your gut doesn't like that one. So for me, I've played around, and water kefir is the one that tends to sit well with my digestive system. So you've just got to listen to your body and play around with these things a little bit.
All right, excellent. Again, thank you so much for that recommendations. And well, let's have a look at the next question. Is there a best time in a cycle to start the acupuncture treatment?
Again, if you're having period pain, if you can come just before your period's due, great. If you're having ovulation issues, coming just before you're due to ovulate, fantastic. But there is benefit throughout your cycle. So if you're trying to plan your initial consultation with a practitioner, just get in as soon as you can, because like I say, most of the time we're generally pretty busy. A lot of us have waiting lists. So I would say to people, let's just get you in, and then from there we can get things planned. And your practitioner will target your treatments appropriately, but there's always a benefit no matter where it is in your cycle.
And perfect. Thank you so much for that. Again, and next question, should we be on Omnitrope long term?
I don't know the answer to that question. I'm sorry.
It is, of course, okay. I wasn't sure about this, so I just wanted to check. But of course, that's not a problem. I will be more than happy to simply forward this as well, yeah, to you, so we can double check it for you. And well, let's have a look at the next question. What are your thoughts about womb warming tea?
Okay, so I don't know what's in this tea, so I can't advise you. I'm going to make the assumption that it is some kind of herbs that have warming effects, like cinnamon. So if I was going to treat a patient who I saw had symptoms of a cold uterus, then I would use herbs that would warm the womb, the uterus. There are caveats to what we do with everything in Chinese medicine. So even things as simple as ginger or peppermint are kind of case sensitive. So we're always kind of very loath to just go, here's a generic product. And actually in the UK, we're very restricted on things like that anyway. But as a really simple example, if a woman has nausea, the classical thing to think about is ginger. But for some women, that is much too heating and will create reflux. It might make them sweat. And actually, peppermint is a better alternative for those women. And it's the same with things like a womb warming tea. You could potentially buy a product like that and already have too much heat within your body. I'm making assumptions here based on what's in the product. And then it's going to create too much heat in you and just increase everything. So if you're looking at products that have a particular function, I would try and contact the person who's selling those products and just check that they're right for you, if that is something that you really want to use, or look at, seeing somebody professionally who can make something specific to you as an individual.
And again, thank you so much for this. All right, and there are like 3 questions left, and have a look at this one. Do you recommend myo-inositol as a supplement?
So this is a supplement that I do talk about with my patients. Like I say, I never say to somebody, take this. I'll say to them, there's this product, please go and read about it and make a decision as, in depth. It's not something that is suitable for everybody, but myo-inositol is something that is really good for potentially improving egg quality. It can be really good for regulating the insulin. So it's used a lot with PCOS patients. So I would say it is a product that I'm aware of. I do think it has a place, but again, it's down to individual. And again, if I was unsure, what I would normally do is I would refer my patients to a nutritionist who could check that this was really a product for them.
Excellent. Thank you so much again, of course, for that. Okay, and let's have a look. So is acupuncture having long-term effect?
It depends on what we're treating. But yes, there can be long-term benefits to acupuncture. Just thinking of really simple examples, I have treated patients in the past with things like cluster migraines, and they've had a course of treatment, their migraines have resolved, and I've not heard from them for 3-4 years, and then they'll ring up and say, I've just had one, can I come back for a treatment? So there's definitely long-term benefits. And from a fertility point of view, if we can balance everything in your body and there's no reason why it should swing back out of balance again, then we can potentially maintain that homeostasis. And I see that quite a lot with patients, for example, who don't have periods, and we manage to induce their menstrual cycle again, and often that menstrual cycle will just keep going. So there's those long-term benefits there.
And excellent again. Thank you so much. And well, it looks like this will be our final question for today. So, is acupuncture available again in the UK?
It's a slightly complex situation at the moment, because it's down to practitioners' governing bodies, it's down to their insurance companies that they're with. The government hasn't made a very clear decision. We think that on the 4th of July, that is when a definitive answer will be given. We are allowed to do emergency treatments at the moment. So from the information I have seen, it does seem like fertility treatment does fall into that category. And I read something the other day, I think it was from the health secretary somewhere, had said that actually we do fall into a field where we are allowed to work. One of the acupuncture governing bodies had chased this up and kind of established this clarification for us. So I would say at the moment, most practitioners are doing emergency treatments, depending on their personal circumstances, and looking towards starting full practice at the beginning of July.
All right. Again, thank you so much for that. Well, we definitely are waiting. You are definitely waiting for this as well. So hopefully 4th of July will be, and it will be clear enough, right, for everyone. And well, that was actually our final question. So thank you all of you for joining us tonight, for all of your questions. And well, sorry, there is one more. So I guess we can still answer it, right, Laura? Excellent. So here it is. So my Chinese friend says acupuncture is supposed to be done every other day for fertility. I explained that it's very expensive in the UK and is usually done every week. So do you think it's better to cluster appointments closer together, although it might be a shorter period, 3 times a week for 6 weeks?
I would say probably in an ideal world, acupuncturists might want to see you 2 or 3 times a week. But the way acupuncture is structured in the UK, it would be very difficult to accommodate a patient potentially that often in practice. Also, I don't know, it's like a case on case thing again. You know, how complex is that patient's history? If, for example, it was somebody who had something really significant going on, like PCOS, yes, in an ideal world, I would love to see somebody 2 or 3 times a week. Every other day is rarely possible because in China, acupuncture is available in a much different way. You know, working hours and the way clinics are structured enable those frequent treatments to happen. But most of us in the UK either work on our own or in a small clinic, so there's not always even somebody there to give a treatment every other day. But if you haven't got a complex condition, you know, I see patients and I do 1 or 2 treatments and they conceive, or I see them for a couple of months and they conceive, and that's me seeing them once a week or once a fortnight. So I think there are some situations where really once a week is sufficient. It's just really about their case. But if you were keen to do acupuncture more regularly, then I would really discuss that with your practitioner and see what provisions they can make to accommodate you, because it may be that they can do a half-hour session rather than an hour session. There may be things that they can do to accommodate that, because you know, realistically, we'd love to see our patients frequently, and a lot of the time more frequently than we do. But you know, cost is a factor, and we've tried to create a system that's as cost effective for us, our patients, as possible.
And again, thank you so much for yet another thorough answer to that, of course. And well, I just want to mention to everyone that if you have any other questions or would like to get in touch with Laura and get some other options somewhere else, as Laura mentioned, you can definitely use the link. I will send it in a minute as well. And that way, there is an option for you to ask Laura any of your questions. Thank you all for all the questions you have asked, of course. And Laura, you have been excellent today with all the answers and helping us out here as well. So thank you so much for joining us once more. And well, I can only say there are lots of thank yous coming up your way. Here they are.
Thanks for having me.
Thank you so much. And is there anything else you would like to add?
Just if you have any questions, get in touch. I don't mind answering questions for people. And potentially share the video, because I really think, you know, trying to educate patients around the options that are available for them will hopefully help people. And I wish you all the best of luck.
Exactly, definitely. Fingers are crossed for all of you. And I just want you to see more of those. Thank you. Very insightful Thanks very much. I listed the ingredients of the tea above. So, and okay, well, is there anything else you can help with this? What website resource do you recommend to help search for acupuncturists?
If you go to the fertility support company, there is a list of practitioners on there that have the higher level training diploma that I have. So if you have complex conditions, definitely go there. You know, we are the practitioners who have done the integrated medicine training and have a lot of background knowledge around IVF and that kind of thing. There's also places like the Fertility Network. I can't think of the name, the Acupuncture Fertility Network. But, you know, the fertility support company would be my first port of call to have a look.
Brilliant. Thank you so much for this as well. And once more, let me just remind everyone that this has been recorded. Therefore, you will have a chance to watch this again, of course, and find some. And of course, you can, as I mentioned, get in touch with Laura so that she can help you out a bit more for sure. And you will be able to find this webinar on myivfanswers.com. And of course, it will be uploaded tomorrow on our YouTube channel. And if you follow our Facebook and Instagram, you will find out about our upcoming events. There are still 3 events coming up. As you know, we will be finishing on the 30th of June with the events. We will have a break, but don't worry, we will be back with more events coming up, so don't worry. And well, I just want you to invite you to our next webinar, as we will start in 30 minutes at 8 p.m. UK time. We will this time connect with Greece and Dr. Tsakos. He was here already as well, so I hope you will be able to join us tonight again. And Laura, again, it was very, very nice to have you here. And I really do hope in the near future we will have more of those events coming up. Thank you so much. Thank you all. Have a lovely, relaxing evening as well. Thanks.
Thank
Bye.
you.